Good afternoon, everybody. Okay, today, as you saw during his meeting with CEOs and labor leaders to discuss the importance of passing the CHIPS Act, the President is doing quite well and continues to be engaged in the important work in front of him. You might have heard a little hoarseness in his voice, which Dr. O'Connor mentioned is one of the few residual symptoms remaining, but I can tell you he was excited to discuss the issue and was also excited to take some questions from you guys today. As you know, Dr. O'Connor provided another update on President Biden's health, indicating that he is doing quite well, which you were able to see for yourself just now. And he continues to respond well to Paxlovid after his 4th day of treatment last night. As we have said, almost everyone is going to get COVID, and because of the hard work we have done since day one, turning around the disjointed COVID response we inherited, we have the tools to ensure that people can go about their daily life and work. The President is fully vaccinated, twice boosted, and is taking Paxlovid. His current health speaks to how Americans should avail themselves of boosters and treatments. I'm going to hand it over now to Dr. Jha, who has some updates. I don't want to get ahead of him on COVID and the administration's effort to aggressively combat monkeypox and protect communities from the virus. He's gonna have an opening. We're gonna keep him from 15-20 minutes to take your questions, and then I know there are other topics that you all want to touch on, and then we'll continue with the briefing. All right, go ahead, Dr. Jha.
Thank you. All right, good afternoon, everybody. So I'm pleased to be with you again today. As Corinne mentioned, the President continues to do well. He was feeling good this weekend. He continues to improve. And before I open up to questions, and again, you all had a chance to see him, many of you had a chance to ask him questions, I want to give you an update on both COVID-19 and monkeypox. So let's talk a little bit about COVID. I want to start by emphasizing the importance of staying up to date on COVID-19 vaccinations as we face BA.5. Approximately 400 Americans are still dying every day, which, while much better than it was when the President took office, is still too many, still too high, particularly because we can now prevent most of these deaths. Our existing vaccines continue to provide robust protection against serious illness, hospitalizations, and deaths. And because protection wanes over time, it is crucial for people to get a booster to stay up to date. Most deaths are happening in people who are not up to date on their vaccines. Let me repeat that. Most deaths are happening in people who are not up to date with their vaccines. And it is critical that people get out and get vaccinated. As I have said this, and as I've said before, and I will say again, if you're over 50 or moderately or severely immunocompromised, but if you're over 50 and haven't gotten a vaccine this year in the year 2022, you should get one right away. I would not wait. Now, looking ahead, we know this virus is constantly evolving, and we can't be complacent. And we are in the much better situation that we are in today because we have been aggressive and forward-leaning in our approach, and we will continue doing that. And to that end, tomorrow, we will be hosting the White House Summit on the future of COVID-19 vaccines. There's a lot of work happening inside the U.S. government and in private industry on the true next generation of COVID-19 vaccines. And the summit will feature some of the cutting edge work being done by U.S. government scientists, scientists in the private sector, companies, American companies who are working on these issues. This summit is an opportunity to bring people together to showcase the science that is already happening, to highlight the work of this administration and what it is doing to bring about these advances for the American people. Now, I want to take a few minutes to talk about monkeypox because this is, I know, also has been on people's minds. And we all saw over the weekend that the World Health Organization declared a public health emergency of international concern. So let me give you a quick update. The declaration by Dr. Tedros of the FIC, the Public Health Emergency of International Concern, was a call to action to the world community to stop the spread of this virus. The international community must work together to protect individuals that have been impacted by monkeypox and those most at risk of contracting the virus. WHO's declaration will allow the United States and other partners to better collaborate, to share data, and to get critical information out to high-risk communities. Here at home, since the earliest days of this outbreak in the US in mid-May, the Biden administration has deployed a robust, comprehensive strategy to combat monkeypox. Our strategy has 4 key pillars, and I want to go through them. First is to dramatically scale up procurement, production, and distribution of vaccines. Second is to significantly expand access to testing. Third is to significantly expand access to treatments. And fourth is outreach to communities most affected by the virus. We have been working around the clock to ramp up our response and to make important progress in short order. To date, we have distributed more than 300,000 vaccines to jurisdictions around the country. We have procured more vaccines than any other country in the world, probably more than every other country in the world combined. FDA is working quickly to finalize the approval of nearly 800,000 additional doses, and we are getting ready to ship these doses to jurisdictions once FDA has finally approved them. We have 1.3 million doses of TPOXX, the treatment for smallpox that can also be used for monkeypox, in our stockpile. And we are working day and night to make access to that treatment easier for providers around the country. When the first case of monkeypox was confirmed in the United States, we had the capacity to do 6,000 tests per week, much higher than demand. But we knew that testing at the time wasn't as convenient for providers as it needed to be. So the CDC immediately started working with 5 of the biggest commercial labs to get monkeypox testing going online, so doctors can use their existing partnerships with commercial labs. Today, because of that work, there is capacity to do 80,000 tests per week. And we are continuing to do extensive outreach to providers to make testing easier. Finally, we've been working on the ground with communities, health partners, members of the LGBT community and others to ensure that we are getting out good information, that we are addressing concerns that they have, we are listening to their concerns. And finally, we want to make sure that all Americans understand that we are continuing to take this virus seriously. We're going to continue working on increasing access to testing, vaccines, and treatments, and making sure that Americans understand what risks and challenges this virus faces and what the administration is doing to respond to it. All right, let me finally finish up by saying you've heard a lot of talk this weekend from the Department of Health and Human Services about what it is planning to do. You heard Secretary Becerra today talk about the importance of this virus and the government's response. We are committed to being not only continue to be aggressive, but to continue to ramp up our response to this virus and protect communities in the United States that have been most affected by monkeypox. Let me stop and take questions. I think I have about 15 minutes or so. And KJP, I'll let you drive the question taking.
All right, go ahead.
Dr. Shah, the President just indicated that he hopes to potentially be able to return back to the West Wing later this week. Can you walk us through what the protocol would be for him to do that? I think day 0 was Thursday. We're at day 4. Is this a negative test tomorrow, or are there additional precautions that Dr. O'Connor may want to evaluate before doing that? Yeah,
it's a great question. So the CDC guidance on this is very clear. 5 days of isolation. Today is, as you said, day 4. So tomorrow will be day 5. He will, once he has a negative test after day 5, he can end his isolation. CDC guidance suggests that he wear a mask when he's around others. The president's going to follow CDC guidance.
Those of us who have been vaccinated but may have also had COVID-19, there's often the extra immunity that comes with that. But given what we now know, but based on what Dr. O'Connor said over the weekend, that this appears to be the BA.5 variant, does that affect sort of what is typically sort of a 90-day window, as we understand it, where you have that enhanced immunity? Are there any signs early on that BA.5 he'll be less likely to have that kind of window?
It's a really good question. What we know is that it is true that in the past, with previous variants, we used to say that if you got infected, you had about a 90-day warranty. And that wasn't a warranty, ironclad, but a high likelihood that you weren't going to get reinfected within 90 days. What we know, because BA.5 is so immune evasive, that we have seen lots of people get reinfected within 90 days. If you got infected with a BA.2 or a BA.1, getting reinfected with BA.5 within 90 days is very common. The duration of protection from BA.5, which you're asking about, we just don't have any data. We don't know. So we're going to track that very closely. Obviously, the president will continue. The good news here is the president's vaccinated, boosted. We will continue to kind of make sure that he is up to date on his vaccines as time goes on. But we don't have any data that I know of on duration of protection after a BA.5 infection.
CDC guidance is also not to travel for 10 days. Does that mean the president won't travel until those 10 days are up?
I don't know the details of the president's schedule. What I will say is that the president plans to follow the CDC guidelines as we have. And right now we're focused on making sure that obviously the president is isolated and he will not leave isolation. His test is negative.
Plans to see him in person before his 5th day is up, to treat him in person?
Do I personally? No, I've been speaking to the president on a regular basis, sometimes on phone, sometimes by FaceTime. Dr. O'Connor sees him. Obviously, we want to limit the number of contacts, right? And so to protect others. And so the footprint around the president has been small and really limited to the most essential people who need to see him.
Thank you, Dr. Jha. What is the window that you'll be watching to see if there is potential for relapse, given the president has taken Paxlovid and we have seen that happening with other people?
Yeah, it's a really good question. Rebound, again, I think I brought this up last week. The clinical data suggests that between 5 and 8% of people have rebound. And that happens sometimes as early as 3 or 4 days, sometimes it can be a little longer. Obviously the president is monitored on an ongoing basis. He's around people. He has a personal physician who sees him on a regular basis. So we will continue monitoring I was going to say the patient, which is true, but the president on an ongoing basis.
And one question on monkeypox. Given the limited testing early on, how many more cases do you think there actually are right now in the United States than what we know about?
Yeah, so I would say, first of all, in terms of testing, we had 6,000 tests available per week. It works out to about 800-900 tests a day. I don't think testing capacity has been a major limitation. One of the challenges has been that a lot of providers have found it difficult to actually order the tests. That's one of the reasons we brought in the national labs, because physicians are very comfortable using national labs. Obviously, we want to continue working on making sure testing is more and more widely available so that we're tracking every case and identifying every case. I don't have a number of how many further cases are out there. But I do expect, by the way, that as all these national labs now come online, as they have over the last week, would not be surprised if we see an increase in cases as testing becomes more robust. That's a very normal part of any outbreak response, is that as testing ramps up, you tend to see an increase in cases because people can identify.
Do you guess the number is significantly higher than what we know right now?
It's very hard for me to make guesses on what the number is. And I think the goal is to make testing easy, widespread, available, so that people can order those tests.
I'm just going to jump around.
Just on the global response to monkeypox, as we know, viruses don't respect borders. What is the U.S. able, willing, prepared to do to address that, especially since this affects communities that are often stigmatized, left out of public health interventions? And then I have a follow-up Trump question for you, Corinne.
I can take it once, Dr. Jha.
Yeah, so we have had a very global, kind of very strong engagement in the global community on monkeypox for years. We have worked with multiple countries on the African continent where most of the disease has been endemic in the past. We continue to have strong partnerships with multiple countries around building up laboratory capacity, that same testing capacity we were talking about here in the United States. It's really essential that other countries have that as well. We're continuing that work. This outbreak obviously now is in many, many other countries as well, and so we're in constant conversations with our European colleagues, with colleagues in other parts of the world. I think this public health emergency declaration will also further galvanize global response. I'll make a couple more points. I mean, the U.S. really on monkeypox has been a global leader. We are the major funder of the company that makes the Jynneos vaccine. We, in fact, have had a very large role to make sure that that vaccine exists and has come into being. So U.S. global leadership on monkeypox, I think, is both longstanding, and we're going to continue doing all of those things to make sure this really is a global response.
Deliverables that we might see?
Well, so we're working with countries, and different countries have different needs, different countries have different technical needs. So we are right now engaged in a lot of both bilateral and multilateral conversations with nations to figure out what help do they need, what kinds of technical and other kinds of expertise can we provide.
Congratulations.
Yeah, thank you. And in fact, I have a question for you later. In fact, just one quick, and if you can humor me later with one, I would appreciate it.
Yes,
very quickly on staying up to date, it was reported that potentially that eligibility could be lower below age 50. Other countries are doing this, offering a 4th shot for adults. Can you give us an update as to whether you expect that to be the case, or your personal reading of the data? Is it necessary for adults who do not have moderate or severe immunocompromised situations under age 50 to get a shot? Many, of course, have gone now, what would it be, 9 or 10 months since their last shot?
Yeah, great question, Josh. Let's kind of take a step back and understand what we do know about being up to date. For all Americans, it is very, very clear from the evidence, like just incontrovertibly clear, that if you got fully vaccinated, if you got your 2 shots but have not gotten your booster, you need to get that. Like, that is essential. It's probably the most important message people need to hear, is if you've not gotten that 3rd shot, it is essential, whether you're over 50 or you're under 50. Basically everybody above the age of 5 needs to have that booster. It just provides a level of protection that is absolutely essential. I think that's point number 1. On point number 2 is certainly for people over 50, and I know you guys are getting tired of me saying it, but it's true, and the president is like very good evidence for this. It is absolutely essential that if it's been more than 5 months since you got your last shot, you absolutely need to get that 2nd booster. On the people under 50 and the 2nd booster, FDA, CDC, I've been very clear since this conversation started. These are FDA, CDC decisions. They're constantly looking at the data to try to make a determination of whether the risks outweigh the benefits. That benefits outweigh the risks, and that evaluation is ongoing. I don't have any news report. I don't know when, if and or when the FDA is going to act on that. What I will say is that these are FDA, CDC decisions, and they're still looking at that data.
Last week that was sort of pumping the brakes on that after reporting a couple weeks earlier that it was ramping up. Can you give us a sense of the trajectory? Has anything changed?
Yeah, I read that report too, and I am not aware of any change in trajectory. What I know is that the FDA scientists are looking at this and trying to make a determination of whether they want to make a change in policy or not.
Thanks. In an effort to try to really firmly establish the history of what has happened here in the last week, are you in a position to explain what the testing regimen was for the president prior to his COVID diagnosis?
What I will say, and what I know is, and again, Corinne, you may have more on this, is that there was a regular cadence. As you might imagine, the president travels. The president has different days where he's interacting with different numbers of people. So all of that goes into the regular cadence. The president got tested on a regular basis, but there was not a single cadence that was true every week. It varied based on a lot of other factors as well, based on what was happening with his travel schedule.
One of the questions that's been asked, and we'll have to raise it again, is why the president's personal physician is not here. Are you familiar with a reason that the president decided not to send his physician here to answer our questions the way that his predecessors have decided to send their physicians here?
KJP, I don't know if you want to start it. I'm happy to give my thoughts, or you want me to just give mine?
Why don't you start and I'll come in.
Yeah, so look, you've heard every day and from the president's physician through his detailed accounting of his assessment, his plan. I have been speaking to both his personal physician, I speak to him every single day at length, with the president on an ongoing basis. And the bottom line is the president has had, thankfully, because he is double vaccinated, double boosted, he's had a relatively mild upper respiratory infection. And in that context, we have provided, I think, an extraordinary amount of transparency about his care, when he got tested positive, how he's done each day, the evolving nature of his symptoms. Is his runny nose a little worse, a little bit better? Like, we've been very, very open and transparent with all of that data. And what I'm able to do is obviously provide that broader context of how to think about the president's condition in the context of the broader COVID response that we have. But the president's physician, I think, has been very, his words have been very clear, and then you've heard from him through his letters every single day.
Forgive me, there's a history here in this room of the president's physician standing here to take questions,
Yeah.
and in part it's because some of your colleagues in the medical profession do have questions, and they've asked us to ask those questions about why the president's doctor ordered him to stop taking Questor and Eliquis. You have done your best to communicate the answer that the president's physician has given, but are you familiar with the reason why the president decided not to send his doctor out to answer those questions specifically?
Yeah, what I will say is, again, if you take a step back and ask the question, what's the medical condition that the president has? Yes, he has COVID, which is very dangerous for people who are not vaccinated, not boosted, not taking therapeutics. But that is not the president. The president's immunity is up to date. He's getting treated. In that context, he's had thankfully, and again, continue monitoring the president and hope that it all continues the way it has gone so far. But he's had, thankfully, a relatively mild respiratory illness. In that context, I think that you've been hearing from the president's physician, you're hearing from me. That is a lot of information, and certainly plenty of information to understand both the president's condition and the decisions that are being made. I don't know if you want to add anything further.
I mean, look, just a couple of things, as you, Steve, mentioned some of our medical colleagues. Just want to say a couple of things about some notable healthcare professionals who have validated our treatment approach, who have been on networks here in this room, and also who have been in newspapers of some folks here. For example, Dr. Lena Wen from George Washington University in the Washington Post, she said, "The president's medical team has done all the right things following his diagnosis. The fact that he contracted the coronavirus doesn't mean that the vaccines don't work, rather succeeded because they are keeping him out of the hospital. The United States has had so much success with vaccines and treatments that even when the president gets the virus, it's business as usual." Dr. Sanjay Gupta, CNN chief medical correspondent, the statistics are very much on his side because of his vaccines and the Paxlovid medication. It's a different time. When President Trump got COVID, there was no vaccine at that point. So this is an example of how effective the vaccines are, just if you compare those two situations. And the reason why I read those two is because we have seen from his doctor that he's had very mild symptoms, that right now he's almost completely resolved, and he has been able to do the work of the American people. And so if you go back to on Thursday, when we learned he was positive, we put out a statement. I put out a statement. Then we had a letter from the doctor, and then we kept our commitment on making sure you heard from the doctor himself. Look, we are in a different place. This is not 21, 22 months ago. This is not even a year and a half ago. And so we've been here almost every day since, not every day since, every work day since, for about an hour, fielding your questions, taking your questions. Your colleagues were able, one of your colleagues right there, was able to ask the president a question, and he answered it directly. That event that he did lasted about an hour. So you've had eyes on him, you've asked questions, you've heard from us, and we're going to continue to give that information as well.
There's one last thing, and that's it for me. Do you foresee a circumstance, Corinne, where the person who treats the commander-in-chief of the armed forces will never or will ever come to this podium?
No, that's not what I'm saying. What I'm saying is that we're in a different place with COVID. Right? We are able to do the business. He's able to do the business of the American people, and not just him. Other Americans as well, because there are vaccines that are free, because there are boosters that are free, because there's Paxlovid, which is an antiviral medication that has helped him really take to the treatment well, really recover very well. You saw him again for your very own eyes. You saw him give a speech at Noble that we just played for all of you, which is why we were a little bit behind in starting this, and also during his CHIPS event. And so that's not what I'm saying. I'm saying that we are just in a different time with COVID.
Thanks, Corinne. Just to go back to some of the Paxlovid rebound questions. Once the president does test negative at some point in the next coming days, how often then will he be tested to determine he stays negative and that there isn't the rebound? What would that testing cadence look like?
It's a good question. So as you know, he may remain PCR positive for a long time. We don't use PCR testing in people who, everybody who recovers. So we don't use PCR testing. But in terms of the regular cadence of his antigen testing, that is not something that I don't know what the cadence will be, and that's something that's going to be decided between him and his physician.
And you mentioned the 90-day warranty that, in previous rounds of COVID and variants people had, and that this one there's no data because we don't know it yet. But, the president, when he does then test negative, what would your recommendation be in terms of what his protocols would be when he goes back to events, when he goes back to engaging with people in the public? Do you have to go back to assuming that he could get it very soon after this? What would the level of caution have to be for the president given this particular variant and the transmission of it right now?
Yeah, so there's a lot of hypotheticals, so let me just say what we know. I mean, the expectation is that while BA.5 is dominant, anybody who's had a BA.5 infection should have a relatively high degree of protection against further BA.5 infections. That's, I think, a reasonable assumption, but there's not a lot of data on that, so we're obviously going to continue collecting that data. This is a president who has been very clear that he wants to be out among the American people, spending time with people, meeting with people, interacting with people. Once he is cleared and is testing negative, I'm assuming that he will go back to some version of that, as you saw, even while he was infected and still is, I guess, but potentially contagious. He continued working, and I expect him to have a schedule that he goes back to a cadence where he's again interacting with people. But the details will obviously vary based on kind of how things go in the days and weeks ahead.
Yeah, thank you. Related question, should we expect a scaled back schedule from the president once he tests negative and is in person again, or is it, back to normal very quickly? Like what should we look for in the coming days after he does test negative and returns in person?
Yeah, I'll give you this is a president who continued working like 8-10 hours a day while he has been infected. He's just worked a lot. Again, let's see when he tests negative. My assumption is that he will continue doing well. Obviously, we're going to continue monitoring him and making sure that does happen. And based on all of that, I think we'll see but he's got a long agenda. He's got a lot of work he wants to be doing for the American people. And so I think there'll be, some negotiation around.
And it'll be daily tests after Wednesday if he were to test positive again on Wednesday. I mean, is that going to be an everyday thing or even faster than that, more rapidly than that? Or I
don't think there's much value of testing more than once a day. If he tests positive, we'll continue following CDC guidelines, and you'll get tested again with a regular cadence.
But it won't necessarily be daily after that, or
No, I think it's a bunch of hypotheticals. I want to make sure we'll make sure he's continuing to feel well. We'll see what the tests show, and then I think make a decision after that.
A couple more, and then we'll let the doctor go.
To follow up on Dr. O'Connor not being here, is this a situation where Dr. O'Connor does not want to come and talk about the president's health, or where the president doesn't want Dr. O'Connor talking about his health?
I will tell you, I have spoken both to the president and to Dr. O'Connor on an ongoing basis, and neither of them has expressed a preference on either. Dr. O'Connor has not at any point said he doesn't want to come. The president has not at any point said he does not want Dr. O'Connor to come. So I would say neither of those is correct.
Okay, and you said again today that the president is following the CDC guidelines very strictly. It seems like there are people in the residence taking his photo with no mask on. I was looking at the guidance for COVID positive people. I don't see any carve-outs for something like that. So is he really following the CDC guidelines?
Yeah, so So a couple of things. What's really important is anybody who's interacted with the president, and it's been a much smaller footprint, has been socially distanced as much as possible. They've all been wearing N95s, and whenever possible, we've done this we've done this outside with windows open.
But isn't the guidance for the person with COVID to be wearing an N95 when there are people around as well?
So, look, Peter, I think if you think about, the president, he does generally wear a mask when he's around other people. He sometimes takes the mask off when he's getting a photo taken. He's been, most of his interactions with others, he has been wearing a mask. And the bottom line is that everybody around him is fully vaccinated and boosted. And he has been, I think, following CDC guidelines very carefully.
All right. April, and then the young woman in front of you. But go ahead, you go first.
Dr. Jha, thank you, Kareem. I just want to find out the results of your contact tracing. Do you have any results from that yet?
Yeah, I can give you an update as of midday today. I think there were 17 people, just want to get the number right, 17 people who were identified as potential close contacts. They've all, of course, been notified. They're all following CDC guidelines, and as of earlier today, none of those 17 people had tested positive.
Thank you. I wanted to go back to monkeypox and ask what the government's response is to some of the backlash regarding the messaging and language that could perpetuate homophobia and transphobia like we saw during the HIV epidemic.
Are there specific things you're concerned about? I mean, I think very clear at this point that the community most affected is the LGBTQ community. This is one of the reasons why I said we've been deeply engaged with them, both to share information, also to learn more, make sure that everybody's communicating in a way that's both scientifically accurate and respectful. Obviously, it's really important that we do not use this moment to propagate homophobic or transphobic messaging, and I think it's really important that we stick to the science, stick to the evidence, and do it in a way that's respectful of people.
Thank you. Just following up on monkeypox, when will you decide, whether it merits declaring a public health emergency, and what other factors would you need to look at?
Yeah, it's a good question. This is a decision that will be made by Secretary Becerra, Department of Health and Human Services. With any outbreak, that evaluation almost sort of begins day one. People start looking at it and thinking about, when is that appropriate? I think Secretary Becerra will make that decision when he thinks that doing so will help with the response. Obviously, a PHE opens up certain capabilities for the Department of Health and Human Services. I know those are conversations that are ongoing and continue, and that'll be a decision made by Secretary Becerra.
And on the monkeypox vaccine, is there consideration of invoking the DPA to produce more of it, and how much do you estimate the U.S. would need total?
Yeah, that's a very good question. Again, and what I will say is right now we have about 780,000 doses that we're planning on making allocations about in the next few days, pending FDA authorization, of course. We're looking at the company that makes it. We're looking at their ability to produce more. We're talking to them about contract manufacturing in the United States and being able to produce more vaccines here. So we're looking at a whole range of options. Obviously, if other tools that the federal government has at its disposal are helpful, we will not be shy about invoking those tools. But right now, we are looking at these sets of factors to see how much more vaccine can we get in the United States.